Joining me now is Dr. April Spencer. She's a breast surgery specialist. Thanks very much for joining us, Dr. April. Now, most of us know what breast cancer is. Why do you think it needs an awareness month?
Oh, the awareness is so important. In fact, we're moving from just simple awareness to action. We've raised awareness for many years, but the reason why it's so important is because globally we see almost over 680,000 deaths. And right now it's one of the most common cancers in women worldwide.
So as you say, some say that Breast Cancer Awareness Month is too passive and doesn't focus enough on
Yeah.
action. So what kinds of actions need to take place to ensure that more women aren't diagnosed with disease?
Yes, so the action is just the ABCs of breast cancer prevention. The A is just being aware of your anatomy. You just mentioned the importance of the breast self exam. Just not only if you feel something, but if you see something, say something. The other A is just being aware of the guidelines. Make sure you have your screening. Many women who were affected by the pandemic globally had delays in their screening, and our current recommendations is to just start your screening at age 40 and a little bit earlier if you have a family history. You just talk to your doctor about what's appropriate for you. But screening is extremely important as well. But again, there was a lot of delays in screening. So I want to encourage women that may have gotten off schedule during the pandemic that it's not too late to get back on track. The other aspect is beyond just being aware of the screening, but behavior. Like it's so important in terms of our action. What can we do to lower our risk? Try to maintain a healthy body weight, be mindful of what we're eating. For example, just lots of fresh fruits and vegetables are helpful, and also avoiding the center aisle of our grocery shopping, meaning reduce our intake of processed foods. And then lastly, see as consumer choices. Ladies, gentlemen, read the labels. There are many carcinogens and toxins in our everyday beauty products, and we're also seeing them in our hair care products. There was a recent study that was just published last week that showed an increased association in breast and uterine cancer and the increased use of permanent hair dyes and relaxers. So again, extremely important in terms of
Right.
action, the ABCs.
A report by the American Cancer Society found breast cancer rates have increased by 0.5% every year. Is that the case globally, and what are the reasons for that increase?
Yeah, so we see globally there still is an increase. A lot of that may be due to access, and I think that's so wonderful that you all mentioned the care centers so that women that are disproportionately affected by an increased rate of breast cancer, oftentimes because there just isn't enough access to screening, because it's still early detection is better protection. So the goal is to make sure you get screened, and more importantly, if you get a callback, meaning your screening mammogram may have been abnormal in some way, make sure you go back. And so it's the follow through and the follow up care that is also an opportunity to try to lower the risk worldwide. And so I'm so glad that you mentioned that because women really need to be encouraged to make sure they follow through with their treatment.
1 in 8 women in the US develop breast cancer in her life, with the highest mortality rates among Black women. What needs to change to bridge this inequity and support minority women?
Yeah. So what needs to change to bridge this inequity amongst minority women? Again, is to make sure that there's not just awareness of what the guidelines are, but to increase the action. Make sure that there are um, programs out there that women in disadvantaged communities can take full advantage of, and that could be anything from going to your local healthcare provider to a lot of societies like the American Society of Breast Surgeons. A lot of the local universities can offer mammograms and even treatment at low cost to no cost. The other thing that's really important is to get involved with your local breast cancer organizations in order to increase the activity, make sure that you are eating well, make sure you are staying active. All those things help to lower the risk, and it's an opportunity to also lower disparity.
All right, Dr. April Spencer, I really appreciate your time.
Thanks for having me, Sally.